Folks, thanks for coming on with us today. My name's John Dubas with Premier Marketing. We'll spend the next 45 minutes to an hour or so discussing the market venue programs available to agents. These are the retail and market venue opportunities offered through different carriers and through the Walmart campaign. We will be spending the bulk of our energy today on Walmart, but wanted to give you an overview of all the options you have available or are coming available to you for this coming AEP. Seems strange to say at the end of March, but planning is underway, and so is staking your claim on different pieces of territory. Today's presentation is being recorded, and it, along with the presentation and a link to that presentation, will be sent to everyone who has expressed interest in today's presentation. If you'll notice on the software package, it does have a section for questions. If you would, put your questions in that session and watch as we go through the presentation, because we may cover them in the course of the presentation, and if so, wouldn't answer them or address them directly until the end of the presentation to be certain. We want to make certain that you have as much information as possible. So since this situation is fluid with the retail programs, we'll be having a number of these presentations, and they will be recorded and available both on our website and on YouTube, and for anyone who requests them as well. That said, a bit of background as we go forward about our organization. Premier Marketing is a national marketing organization founded in 1968. We're part of the Integrity Marketing Platform with offices across the country. We act as an insurance wholesaler, providing insurance services to the public through independent insurance agents such as yourself, and we do so with contracts with independent agents at the highest possible commission level and with recruiting contracts available to those who qualify. As I mentioned, we were founded in 1968, so that means we recently experienced a milestone on our history, our 50th anniversary, which we feel is quite an accomplishment for what began as a small family agency in rural Nebraska that's grown into one of the largest marketing organizations of its type in our country. We do so through a full portfolio of products, the full gambit of Medicare programs, including Medicare Advantage and Medicare Supplement plans and standalone Part D prescription drug programs, but also a full portfolio of life insurance and annuity products, including final expense life insurance and pre-need programs, long and short-term care plans, disability income programs, and ancillary benefits, including dental, vision, hearing programs, critical illness and cancer plans, and hospital indemnity programs. That Medicare Advantage portfolio makes a big difference when we discuss retail marketing, because it has all the national carriers across the country and many of the strong regional carriers that make a difference for you in your marketplace, with that same philosophy carrying over into the standalone PDP space, where the national carriers are available to you through our organization. Our Medicare Supplement portfolio is very large and robust and includes tools to help you be successful in that space as well, and is an area that in many circumstances is ignored to a degree in the retail programs, and that's a bit of a mistake in my mind. When we look at the ancillary carriers in each of the categories, the national programs are there for your use, and these make a great, not only a way of making certain that our prospects and clients have all the coverage they need, but it's also a great way to use them as a prospecting tool, and of course as another means of income for our agencies as well. When we look at the Medicare market all over, this is something that is a viable piece of selection process for retail as well, outside of the fact that more than 10,000 people a day are turning 65, one every 10 seconds. We have to realize that that's not the true indicator of the size of our Medicare market, because a portion of those individuals will continue to work past 65, many of them not accessing their Medicare benefits, but about a sixth of the Medicare population are under the age of 65 and make a strong component of the folks we need to reach in a number of different marketing campaigns, including retail, which is a natural way to identify these folks, which are very difficult to point out in different marketing campaigns otherwise. So when we look at the different opportunities we have with retail, we need to make certain that we realize that retail itself is just one portion of an overall marketing program that we need to put into play. If we use it as the hub, there are different things we can do to make retail much more successful, and we'll have a particular presentation on that as well, on making retail pay. But if you're going to use that as an adjunct to other marketing activity you already have going in a particular area, it works pretty much the same way. When we look at the different options we have, there are a number of them, depending upon the area in which you choose to market. There are the carrier-based retail programs, there's the Walmart-based program, and there's one we make up on our own, so to speak, and we'll touch on each of those as we go through. Keep in mind, the list of carrier retail programs here is not intended to be all-inclusive. I'm certain there are other programs available in different parts of the country, and as we have more details on them, we will incorporate them into this presentation as well. When we look at what Aetna offers, they are into retail big time. Obviously, with the incorporation into the CVS system, they have a natural partner, and with what CVS is doing with much of their locations and possibly, inoculation for the COVID-19 in many locations, and then the minute clinics within many of these, you're seeing a further integration of different types of health services through the Aetna CVS merger. You have different requirements to go through in this particular circumstance to participate with the Aetna program. They make certain that you are certified for their portfolio of product, and that the filing of both the events and the reports thereafter go through Aetna systems. You have flexibility in most markets for the days and hours that you wish to work. Normally there's a 10-hour commitment in most markets, but a big piece here is the requirements may vary by market. There are different organizations or different management individuals within the state of Texas that may handle it differently from one part of Texas to another. So if you're looking across the country, the key element with working with Aetna is having a relationship and making certain that that relationship helps dictate your willingness to participate in such a campaign with the area marketing managers. So this is pushed down to local markets in many circumstances, and how they deliver this program depends upon the individual market. And that goes into even some of the different collateral that is available for the different stores. Aetna does focus on stores in the MA markets with some of the expansion they've done this past year and what may or may not come this coming fall. We see a large area for which this is a suitable campaign, and those broker managers know that market, and they use a 10-factor segmentation program to help determine each store's potential. So they're dealing with data as to, okay, why this location, and how well do you feel that it is going to succeed in this initiative. There is, of course, a big focus on the CVS stores. They do have some Kroger, Giant Eagle, Wegmans, and other stores available depending upon the market. However, if you're going to play with Aetna, you're probably going to play in a CVS store. Aetna does deliver different rules of the road as well. They have portal access granted through the local market. That's part of the reason you want to have that relationship with those area managers. They do verifications on what you've got in your pocket and what you're looking to do. Are you certified? Do you have everything that needs to come into play? And as time goes closer, have you restore or reserve the hours and the locations that are available that are granted to you in a timely fashion, and have you completed all the training and the attestations that are necessary? Aetna does deliver a lot of materials to market for these locations, including access to Salesforce for the leads follow-up, and they do also many times additional marketing in a particular market to drive traffic to your store. The kiosk cost, this is a variation from market to market. Some agent managers will charge for the kiosk and it's yours to use. You own it thereafter. Some of them basically will do a kind of a deposit of sorts on the material, and then you return it after the marketing season, after AEP. So this is part of the reason why having that relationship with those area managers is also important, because they have the detail on these, and in most markets, they're the ones making up the requirements as we go along. If you look at the Blue Cross Blue Shield contracts in Texas and in its 4 sister states of the HCSC contract, they are doing a limited outreach with different pieces of retail as well. And they work mainly with Walgreens in different locations. They have limited shifts. It's only 8 hours a week. It has been here in Texas. And this too is driven by the Blue Cross Blue Shield marketing managers. So as further details come about, you'll hear about them as well from us. But it's also important to note that both Aetna and Blue Cross Blue Shield in this part of the world are also involved in the Walmart campaigns as well. These 2 pieces that we just seen deal with a Blue Cross Blue Shield only campaign in these specific markets. When you look at a quasi-sister organization with Anthem, they too have standardized shifts and vendor partners that can vary from location to location. It is another campaign that's driven by area agent managers. So if you don't know who your agent manager is with any of these programs, we need to make certain that you have that information, that you reach out to them, and that they are aware of the fact that you are interested in campaigns with these particular carriers. Anthem, too, is a Walmart participant in the areas where that campaign is available to them with their product footprint. Baylor, Scott & White, if you're sticking in Texas, it too has a program that is driven by the area managers in the markets. The vendor partners vary into different locations. There are 254 counties in the state of Texas. Baylor, Scott & White, I think, operates in approximately 1/4 of that area. And they work heavily with HEB and CVS and some other carriers as well. These are, once again, driven by the agent managers for that product in this market. There is yet not confirmation as to whether or not Baylor, Scott & White will be part of the Walmart campaigns. I know in the past that they have, but I haven't been able to verify that for today's presentation. Cigna Medicare, formerly Cigna Health Springs, is an organization that is, once again, wants you to be product certified. They do not have an individual campaign, but want as many of their agents involved in the Walmart participation, the Walmart campaign, as possible. They will have additional trainings and other pieces that will help the agents be more effective in those areas with the Cigna product as well. UnitedHealthcare, well, they have their own huge campaign that they do. It comes about with a variation of filing requirements and certification. You got to be certified for the full portfolio of product, whether you sell it or not. So if you're not a DSNP agent, doesn't matter. They want you certified for it anyway. And they also have an additional marketing certification for you to complete to be eligible for participation in both this campaign and in the Walmart campaign, which they participate in as well. They have their own software system through the Be Connected system that you use to file the events and activity reports thereafter. It's a campaign that has some flexibility for you when it comes to the days and hours you choose to work, but they want you to commit to at least 15 hours per week. There is, as I mentioned, multiple stores, the brand selection that's available, and those will be more detail available to us in the 1st of July. Just like the other campaigns you're seeing, they're directed through territory agent managers. An interesting thing about United's campaign is They meet in June for different stores. The managers in different areas select the stores at that time, and then they fill them on the back end thereafter. It's not like they necessarily take a request for a store and then procure that store and then offer it back. So you've got a number of different campaigns that are offered supplementary, well, in addition to, let's put it that way. Let's quit trying to use a big word there, John. They are used in addition to the Walmart campaigns, independent of them, by the different carriers. But you will see, of course, that when you speak to retail, most of the time, a lot of the agents automatically think of Walmart, directed by Direct Health. These are stores that are available across the country with products that are available through the organization that procures the store for you. It offers the experience through a choice model where they're looking for at least 2 Medicare carriers minimum in each of the markets that are served. Those are normally one of the big boys, United, Aetna, Humana, in those different markets where they want the agent to be ready to sell multiple programs. And if they don't sell multiple programs, they want them to be prepared to answer why. There are a ton of carriers across the country that are participating in the program. This is by no means an all-exclusive group. And it is a program that works through October through past the end of AEP. There are Thanksgiving blackout dates that come into play, and this program does do a very good job in communicating with agents. They have regularly scheduled conference calls, and they want to make certain that everything is in place well in advance of the beginning of the project. And they want the certifications done ahead of time as well. Part of that is because of the certifications, when they come into play, they have to be downloaded into the separate system, and that takes a bit of time too. And so for an agent to be shown ready to sell in the Walmart program, it doesn't necessarily reflect the same date as the certification with the carrier because it takes a while for that downloading. Here's the timetable that comes into play for us right now, and you'll notice that, gee, John, end of April, you've got some dates here. Store selection for round 1 begins in 2 days. What's the scoop here? Well, keep in mind, the list of all the stores includes all the stores across the country. Round 1 applies only to agents who have the right of first refusal. And those are the agents that have participated in the campaign in the past, have successfully conducted themselves according to the standards that Walmart puts out for them, and then they have the opportunity to ask for that store back the next year. Thereafter, once we get into round 2, it's all the stores that are left that haven't been worked in the past by an agent successfully. So it's a huge amount of stores, and with some of the expansion we anticipate from carriers across the country, there'll be a ton of new opportunity as well. Once the round begins for a selection, the quicker the agent has an opportunity to put in their dibs on it, the better off you get. It's first come, first served. And as each round closes, you'll see obviously a differing list then made available thereafter. Just because someone puts in a dib for a store, so to speak, or speaks up for a store, doesn't guarantee that they get that store, however, either, because there are additional requirements we'll talk about in order to make certain that we ensure the store that comes into play. That will continue then into a third round. Generally, in the past, we've seen Walmart also push back with additional stores thereafter for areas that they are looking for coverage in. So that might be a lesser opportunity for most folks because it's geographically unequal, so to speak. Those stores don't pop up everywhere across the country. So they're looking for those first days in the store and the end of AEP, and then the last day in the store as well. So we're going to run through and send out reminders as the selection cycle rolls through in order to make certain that you have the information you need as you move forward with these stores. Round 2, well, that's the first round for open store requests, as we mentioned. Well, round one, as mentioned, is reserved for first right of refusal from the folks that worked the store before. And it's important to note, once again, we're requesting a store, not guaranteeing it until the store's confirmed at the end of the cycle. The cost is $500 per store. We take the billing and procure the funding from you, and you can qualify for a $250 refund based on agent compliance and following the program rules as well. The stores are to be staffed a minimum of 20 hours per week with at least 3 days a week in that duration for the program. And if not, the store is forfeited and no refund is available. The events must be scheduled on the Direct Health portal as they're considered a sales event and are reported to the carriers and CMS. There are daily reporting and checking in requirements with the pharmacies that are necessary for those reporting thresholds to be met, and that's at least 90% of the thresholds. So that report being happening each day twice, 90% of the time. And the agents, as I mentioned, must be contracted with a minimum of 2 participating MA carriers in that market to staff the store. Agents have to attend all the events as scheduled. Failure to appear is a CMS violation, and agents are required to follow all the CMS rules and regulations, including those for an informal sales event. There are additional trainings that an agent has to complete before staffing a store. They're Brain Shark trainings, really cool trainings that are easy to do. We've got samples here in a second. And there's usually that deadline that makes certain that we come into play. Remember last year, it was the 10th of September. It's a good idea to have multiple agents sharing the store as best practice. A lot of times folks will say, well, gee, if I don't have the store all to myself, my share of the sales out of that store are going to dip. Well, your share of the sales may dip with an additional person in the store, but statistically, we've seen that having more agents in a store actually increases the number of sales per agent. So sharing a store isn't something to be frightened of at all. It's important that we must complete the reporting every day in the store by each agent. It's important we check in with the pharmacy for each shift. It's a great way to make certain that they know that they can send people to your kiosk. It's important to have those 2 or 3 top MA carriers in the platform, and we have all the hours that come into play and that we certified in the time frame that's given to us. For those who work with an agency, it's important to realize we shouldn't be requesting stores and then trying to fill them with an agent on the back end. You can't back out of the store. It's an uncomfortable situation, and generally it just doesn't work out well. It's important, too, to note that when you select a store, you're committed to the store for the entirety of the program. You can't drop a store midway through. And it's important that the agents in a store be actively licensed at the time of request. You can't predict the future and hope that it pans out well. We've got to make certain that we're actively marketing the store properly. And it's important to note as well that you need some credit card information on file when making the store request. That card won't be charged until it's confirmed that you have the store, but we need that payment information in play. So once again, you've got the information here with the right of first refusal, folks. That is asking for payment by mid-month, and those are for folks that have already been in those stores in the past and are going back to the same store. Round 2, same principle applies. It's just toward the end of the month as to when the request date ends. Oh, gee, we're halfway through March for that, or June for that. It's important to note that the sooner the request comes in, the better. So it's important to be in communication with your premier marketer to know which store locations are available to you in your markets. One of the things that you'll have as parameters to help you select stores are information about the eligibles in a particular area. And how deep penetration is in that area with Medicare Advantage programs as well. You additionally have in-store resources that include the prescription manager in the store, some additional information about rural stores as to the number of eligibles that they serve, and then of course they make available information on low-income subsidy eligibles by the county as well, which can be helpful for you in looking at special election periods all year round. When you get into the third round, just later dates, same principle, where it's first come, first served. You got to have the payment ready, and those requests, the deadlines end in mid-July. Some of the things that we look for is the store request is made only if the agent's credit card information is on file. The agent pays for the store up front when the store is awarded. There's no backing out of a store, and the carrier contracts need to be in place in order to request a particular location. Some of the things that are very important, of course, are the relationships that are made and maintained and grown through in-store relationships. These include the store manager and the pharmacy manager, in many cases the upfront folks at the registers. It's important to meet with the pharmacy manager before the campaign actually begins and put into play some of the marketing pieces that we'll speak about in making retail pay presentation coming about. If you are in one of those first rights of first refusal, you've probably been working that store year-round anyway. But in any case, as you are awarded the store, don't wait. Go in and start establishing that relationship right away. Do it on a face-to-face basis. Be persistent, but also professional. And keep in mind, you're looking to add value to the services that Walmart delivers to their patients in these stores. Their Direct Health has great support for you as well, both by email and by phone. I would strongly recommend documenting anything in these circumstances, much as we do with applications that are submitted electronically, making certain that we have a trail to verify our request. This gives you information about the training programs, how you reach them through the software. They have the different pieces that come into play, and it tells you too of your certification within this system, not within the carrier, because you may be contracted and certified with the carrier, but that information had not yet been downloaded into this system. There is a delay. It's important that we also conduct ourselves in a manner that's professional and also gives us the opportunity to recoup half of our investment into the store. So the technology that we're using, for personal reasons, should be kept after the shift. Be mindful of the reason why you're in the store, not to just pass time, but to actually garner prospects, and that the attire that you're wearing is suitable for the location and the circumstance. It's also important to be aware that we're not to wear or display items branded by any carrier or agency. Non-program branded materials are not to be used either. Walmart's campaign has a ton of nice materials that they make available for us for our use, and we're to use those campaigns. It gives us a number of tools as well, including a schedule template, which we can use and then mark as appropriate for our upcoming campaigns, and it'll give the public an opportunity to plan for your presence in that store. If you also want to work a campaign with a center of influence in your community that's not a pharmacy, you can do so through a do-it-yourself campaign where you're looking for that center of influence and use it as a hub of your activity, utilizing much of the same concept in any of the retail locations where you have multiple carriers in your portfolio. You are doing things consistently with the organization, and you are marketing that program independent of any other type of assistance, because you realize what you get out of it is what you put into it as well. If it is a pharmacist that you're working with, if we're looking at a small independent pharmacy, these can be very, very helpful to you because the staffing may not be as large as in a chain, and they may not have some of the resources for low-income subsidy or some of the other pieces that come into play. So you can be of great value in those locations as well. So you're offering yourself as a resource and freeing up the folks within the location to do what they're supposed to do as part of their job circumstance. So some of the things that we can use to help you is look at some of the tools we have available on our website. Watch for the follow-up of today's presentation and the introduction of subsequent presentations that will be coming shortly. Make certain that the contracting and certification process is completed thoroughly and early, and work on a success strategy that can make this a huge difference for you. Just keep in mind, retail, when we first started doing it a long time ago, you had people that would line up for you. Now it seems like unless there's a specific question, they're more interested in that package of bologna than they are in you, because they don't realize the value that you bring many times with your annual review. Different things can come into play with some of the subsequent pieces we'll be kicking out that will help you put into play a success strategy to make this a worthwhile project to you. Because remember, you don't want to put all your eggs in one basket. And if you can incorporate multiple campaigns into retail, utilizing many of the other standard outreach that we have available, can make retail much more successful for you. Some of the things, obviously, that we'll have to do our homework on are certifications and trainings with the different carriers. Make certain that you are up to date on your electronic enrollment training as well. Many of the carriers are very, very, very insistent on kicking out information on their different e-apps, particularly now with our social distancing and the challenges we have in that space. But we also have additional information available for you that can help in that regard with the electronic tools that we offer that can be a valid consideration for you when it comes to comparing the different campaigns that are out there. Many of the carriers also have retail training. Some of them require you to take that in order for you to participate in these programs. Some of them it's just an extra. I got to tell you, do it. It can make a difference for you. That one tip you could pick up from a carrier that you thought, well, man, why am I wasting my time? That might be the one tip that gets you an extra 5, 6, 7, 10 apps during the campaign. And if you take that times your commission level, you can see where it's well worth it. It's also important to watch for some of the different pieces that we kick out on a regular basis on grassroots marketing. And that's the piece where I'm referring to. It's like making retail pay, centering on that location, and then gravitating out from it to different centers of influence in the community to make them aware of your presence in that store and how you can help. We have up-to-date low-income subsidy and Medicare savings program trainings available for you as well, in addition to the different quote engines that are available to you for both MedSup and our Medicare Center campaign. Many folks are still comfortable or most comfortable with using the Medicare.gov plan finder, even with some of the challenges that it had this past year. We have different pieces on that, on how to use that and make you comfortable with that campaign and then transitioning into a sales performance thereafter. We have recently come out with some additional Medicare 101 information available to you. These are very helpful if you are utilizing seminar trainings in the area around your store, and is a great way to help drive additional foot traffic to your location. The government also makes different CMS material available to you that can be helpful in explaining what you're doing and why you're doing it, where you're looking to make certain that the Medicare drug coverage and the overall cost of their programs are as affordable as possible. They are available in English and Spanish, and they have different worksheets available for you as well that can help you get the information in play if you're collecting at one site, storing it compliantly, and then working up a review later. anytime you become involved in retail, there are a ton of people out there that can help you be more successful with it. That can be even the folks within the Walmart campaign themselves or thereafter. So track your activity. Part of what we're looking to do as we visit the community around us is we track that activity, and we go back to our office, procure the different flyers that we're using in that activity, and take them to the store and pharmacy management of the location that we're working, excuse me, to make certain that they're aware of what you're doing to help them market their store as well. You'll generate great goodwill and have a higher likelihood of having referrals come to you from the different staff within that store. So some of the additional things we can do to help, as you look for multiple carriers in each of those markets, the Insurance Bay software system will allow you to create an agent profile and contract with multiple carriers quickly and efficiently. Not all carriers will participate in this program, but it's a great way to have your information all in one spot and make contracting easier. We also make available to you discounted errors and admissions coverage, where the purchase of this program covers you regardless of who your upline is. We realize that as independent insurance agents, you have the opportunity to market with multiple organizations. This will cover you regardless of who your upline is. We also take that same concept into making certain that your insurance license stays in play as well, with bundled continuing education packages through our relationship with WebCE. And we also help you with your own benefit package, where you can obtain modified guarantee issue, non-cancelable DI coverage for yourself at a discounted rate where you share in the commission, so you can help with your own benefit package as well. As I mentioned, today's presentation and others that we conduct are recorded and put on our website at premiersmi.com and also on our YouTube site as well. Watch for those, and they may be very helpful to you in combining different marketing campaigns into an overall marketing strategy. I mentioned earlier too that because of what we're all experiencing with social distancing and COVID-19, we have a multitude of non-face-to-face or software systems that can help you with multiple types of products. And this gives you the opportunity to be practiced when AEP comes up and we're working in a face-to-face situation, hopefully at that time, in the different retail settings. They include our CSG actuarial quote engine for MedSup and ancillary products, and our Medicare Center program for MA and PDP programs. Keep in mind, both those systems have the capability of obtaining and storing an electronic scope of appointment for you as well. That CSG system works across the board with multiple carriers and multiple products, and works you through a process to help for cross-selling. That Medicare Center program can act as a CRM for you as well, to help you year over year do accurate reviews for your prospects and clients. All that said, we want to make certain that you realize that all your information is available for production, that we make certain that you have a firm grasp of what all you're earning, and we have a system within our website that will help you with that, and help you too with different lead programs across the board. We do still help with direct mail as well, based on production, a great way to do a regular source of marketing into a chosen market at a very reasonable price. All that said and done, the reason we do these webinars and offer this information is we do want to work with you and earn business with you. And in doing so, we're looking at the different ways to get in front of people and become profitable. And what many people see are the end results, and they don't realize that in many times it takes a lot of work on the back end in order to get there. We're out to help you get there. If retail is of interest to you, we've got to make certain that it becomes part of your marketing plan, and you start preparing for it now. If you're going to a carrier to look at locations, and you have an area in mind, setting up a backdrop of what you're already doing in that area can help sway the decision as to who gets a store or not. If you have a store that you've worked year over year successfully with Walmart, well, adding to some of the marketing activity in the area around that store can help you be even more successful. So we need to make that part of an overall marketing plan and agree to move forward now. John Wayne said in the Cowboys, we're burning daylight. All that said and done, you can reach out to your marketer here at Premier at 1-800-365-8208 or through our website at premiersmi.com. Let's make certain that we nail down the stores we need to within the Walmart campaign as well. And as additional information comes from the carriers with their individual campaigns, we're mindful of that and are looking forward to getting more information to see if that is something that would best suit our purposes. So all that said and done, we really appreciate the time you spent with us here today. We realize that is your most valuable resource. We look forward to the opportunity to speak with you again very soon. And in the meantime, we wish you good selling. Thanks so much. Watch for the follow-up, and we'll talk to you soon.